does nobody believe in adrenal fatigue? Today we're going to talk about why conventional medicine doesn't have it as a diagnosis. I'm Dr. Carrie Lam, and this is Dr. Michael Lam, an authority on adrenal fatigue. So, why is adrenal fatigue not part of conventional medicine or a diagnosis?
Well, adrenal fatigue is a relatively new discovery, and it is not at the point that it reaches the criteria to be able to consider a medical diagnosis for good reasons. We look at adrenal fatigue, which is a terminology that we kind of assign to people who have maybe cortisol imbalances from the clinical aspect, but the symptoms are quite convoluted, and the pathology is such that if you really take out the adrenal glands from the body, pathologically it doesn't show up in terms of any abnormality. So rightfully so, it should not be considered a medical diagnosis at this particular point in time.
So how are some ways that we can be able to see if someone has adrenal fatigue?
Well, as just a health condition, the best way is to go by the signs and the symptoms. Okay. Now remember that not every condition is a medical condition. You can be tired and not have a diagnosis of chronic fatigue. You can have sleeplessness and not necessarily be told that you have insomnia. So medical health has a range of continuum. And in the very mild and moderate stage where it's not yet considered a medical problem, this is what we are dealing with at this particular point in time in terms of adrenal issues.
So what are some of the things that in conventional medicine kind of make it sound like it could be adrenal fatigue? I know you mentioned chronic fatigue. How about like real adrenal issues like Addison's disease?
Well, Addison's disease is a recognized medical diagnosis and condition that affect about 4 out of 100,000 people. The most famous patient of Addison's disease is President John F. Kennedy. And it is a very, very specific diagnosis that requires, generally speaking, steroid replacement for life. Adrenal fatigue is a terminology that was assigned to a group of people who have similar but much scaled down symptoms that are oftentimes not medically driven in terms of nomenclature, but has some subtle signs and symptoms that is very mild. But it presents in a way that's almost like some form of mild Addison's because of the presentation.
So you're saying it might not just only be the adrenals, but really it's there are other systems involved?
Well, our research has shown over the years that the adrenal system, yes, is responsible for many hormones that regulate the body for well function. But the body's response to stress is actually much more comprehensive than just the adrenal system, because stress is so pervasive and survival of our body depends on a well-maintained system. The body has redundant systems, and the systems involved in stress response include the adrenals, but that also includes multiple circuits. We call it circuits because there are 6 circuits: the neuroaffect circuit, the hormonal circuit, the detoxification circuits, the
immune circuit.
Yeah, immune circuits. So there are cardionomic. So there are multiple circuits and multiple systems. Each circuit has 3 systems that are designed to be activated in unison, like a symphony that works together when stress arrives in our doorsteps. So it depends on to the level of stress that the body senses. The body will activate various components of what we call the neuroendometabolic circuits, or the neuroendometabolic stress response, the NEM response. So it depends on the degree of stress, the intensity, and the body responds to it. The body usually self-regulates, get rid of the stress once it arrives on our doorsteps. It's much more than just the adrenal system, although many of the symptoms we tend now to service seems to be more correlated, but if you really study harder, it is really a system-wide problem. That's why it's so convoluted.
And because there's so many systems, there's so much convolution, it's kind of hard to just pinpoint something for a diagnosis, right? Or for a disease. You usually need, for a syndrome, you need like 5 things that go into the syndrome. But people with adrenal fatigue, they present with so many different types of symptoms.
The symptoms are so wide, overlapping, convoluted. It almost defies medical logic if we use a compartmentalized approach, which is what modern medicine do. And in the case of adrenal fatigue, we really have to understand the body from a holistic perspective, that the body is very smart. The body will not allow a compartmentalization approach in terms of dealing with it, because it's not like a broken thumb. This is a systemic problem, so therefore it requires a systemic approach. Now, I had a hard time understanding this concept myself when I went through this, because for the longest time, nobody can understand me. No doctors can really help me, because everyone, including myself, was trained in the compartmentalization perspective. So when you are kind of pigeonhole yourself into that perspective, you tend to be blinded to look at all the other problems as part of this unified whole.
So the people that go to doctors, they get individualized diagnoses of conditions, but really not the whole person outlook of what might be going on, which is the chronic stress and the chronic fatigue that might be wearing their body down and manifesting in different symptoms.
Yeah, the approach to see the doctor is correct, and everyone should do that to make sure there's nothing that mimics this type of condition. But if everything is normal, so to say, then, and if you want to look outside the box, then the question is, what is really going on? Now, if you have a body that is telling you something, and you believe that your body is telling you the truth, then you have a responsibility to follow that and track it and see what is really going on. And so that is ultimately what I think can lead to further discovery on your own to really understand. And that's what happened to me, because it's very easy, because I know all about the conventional side, but I just don't have the answers. But I know the answer is there, so I cannot lie to myself or tell myself that it does not exist. It's just maybe I don't understand. So that starts me on my own journey.
So for people out there who feel like no one believes in them, what should they do?
Well, that is actually quite normal. And so there's nothing really you can do other than first is to educate yourself. Other people cannot solve your problem. You have to solve your problem, and you start your own solution by educating yourself. Knowledge is power, and when you learn, and you will understand, and you will have the common sense to guide you logically through every step. Now, the body does behave logically, and so you can bring your discoveries to your doctors and try to educate them, or you can find someone who really understands, who speaks the language that you speak in order to help your body. No one's going to be able to help you if they don't even understand what you're going through. And this is the important part to consider.
Yeah, so today we learned about why nobody believes in adrenal fatigue, but know that there are people who do, that you can find in order to empower yourself, go on your journey, gain the knowledge, and believe in yourself. And so if you have any questions, go online and find out a little more and find people who are like-minded like you, right?
Right. And that is the key, because, no one's going to take care of your body better than you. You know that. I know that. We are here to help you. We are here to provide the education so that you are empowered to take control of your health.
Yeah, so hopefully you have a good day and go on your journey.